Hello, I'm Joan Justice with HealthWorks Collective, and I'm here with Jeanne Pinder of ClearHealthCosts. Jeanne and her team at ClearHealthCosts have developed an interactive website with cost data on about 30 medical procedures from different providers so that patients can see how the costs vary from provider to provider and make choices accordingly. Jeanne, why do you think that there's so little cost transparency in healthcare?
Well, we think a couple of reasons. A lot of people are used to the $20 copay. So if your insurance company is paying, you might not actually know what the provider charges. You might not know that a mammogram could cost $50 or $607. We also think that it's partly because people believe that there's a lot of regulation or that prices are simply more regular in healthcare. It just stands to reason. What other marketplace would you see prices varying by a factor of 10, 15, 20? And then thirdly, we think that there's an emotional component to healthcare costs and purchases. Most people don't feel comfortable negotiating, never thought about negotiating over healthcare pricing the way they might over a rug in the Moroccan souk.
Right.
And also because people tend not to be at their best when they're at the doctor's office. You might be ill, you might be anxious, you might be unconscious. So the notion of negotiating or even comprehending price variations is simply foreign to most of us.
Right. Great. Thanks for that. And now please tell us a little bit about your mission, about how you got started, and about how you hope to reduce healthcare costs while raising quality of care and patient satisfaction also.
Oh, thanks. So I came here from journalism. Actually, I was at the New York Times for almost 25 years as a reporter, editor, and HR exec. I volunteered for a buyout in 2009 because I wanted to do something else. So I come from a long tradition of finding stuff out and telling people about it.
Mm-hmm.
We think transparency is a great thing in journalism. So one of the things that happened to me before I started this business was that I received a hospital bill, including a charge for $1,419 for a drug that I found I could buy online for $2.49.
Wow. That's a big difference.
It's a big difference. I argued about the bill. I thought I was being charged too much. I complained about it and ultimately decided that there was probably a reason to think that if that bill was that strange, what about all of these bills? Maybe they were that way too. So
Yes.
started asking the naive question, like, what does stuff cost?
Mm-hmm.
Healthcare, why can't we know? Why are these prices so obscure? So what we've done is to build a website, collect prices, mostly in New York and San Francisco for right now. We're comparing those prices also to the prices that the government pays via Medicare, because that's the closest thing in this marketplace to a fixed or benchmark price.
Mm-hmm.
We've got information on prescription drugs, buying insurance, ways to save money.
Yeah, I saw that. Yeah.
Thanks. Yeah. And we're also blogging to just tell people that there's stuff going on in this marketplace that you ought to know about.
Yeah, great. I saw your website. It's great, Jeanne. Thanks so much for your time here. I think you've done a great thing. And you and your team at Clear Health Costs have certainly contributed to cost transparency in healthcare. And I hope this is the start of a big trend. Thank you so much.
So do we.
Yeah.
You.
Bye.
Bye.